Let's talk about the clinical significance of the oxytocin hormone. Now, we already know that there are two main targets of the oxytocin hormone, one being the mammary gland and other being the uterus. Now, uterus during the childbirth, during the pregnancy, is ripe with the receptors of the oxytocin. Now, this happens usually in the late stages of the pregnancy, that the uterus expresses large amount of oxytocin receptors, and it is then the release of large amount of oxytocin in the bloodstream that initiates the labor. Now, the labor and the expression of the oxytocin on these receptors is enhanced by the estrogens, but it is inhibited by the progesterones. So, if the patient is in the late stages of pregnancy having large amount of receptors in the uterus but is not undergoing delivery, it usually means that oxytocin is not being released by the posterior pituitary. So what we do in such a patient is that we actually give that patient intravenous oxytocin. Now that oxytocin is given intravenous via a drip in slow amounts. Now whenever this oxytocin, whenever it's given in intravenous dose, the patient's contractions are monitored, and when that monitoring gets up to a level, up a threshold, to a point where the delivery starts, the infusion of the external oxytocin is stopped, because at that point delivery has started. There's complete saturation of all of these receptors, because now we have given the patient the oxytocin hormones, even though we have given it via an external route. Now, when this happens, delivery starts, cervix starts to open, and there is the delivery of the child through the birth canal. And all of this, even though there are all of the other hormones like estrogens, progesterones, FSH, and other stimuli that do regulate the delivery of the child, usually it is the oxytocin hormone which modulates and regulates the delivery of the child from the initial opening of the cervix to the transfer of the child from the internal os all the way out of the birth canal. So this was the lecture on the hormones of the posterior pituitary. Now, posterior pituitary is a neurohypophysis, that it is actually an extension of a brain instead of being a separate tissue, and it releases two hormones, and these hormones are actually synthesized in the hypothalamus but then are released in the plexus of the hypophyseal arteries into the systemic circulation. And these hormones, first we studied about the vasopressin or the antidiuretic hormone, because it performs against the diuresis. It performs the concentration of the urine. We studied its effect, its regulation, and we studied its clinical significance. That what will happen if there is decreased amount of ADH, or what will happen if there is increased amount of ADH. Then we learned about the oxytocin hormone, which are its main site of action, what happens there, and how the loop feedback mechanism works at those sites, and what is the primary reflex of the oxytocin hormone, being the milk ejection reflex. Then we learned about its clinical significance and its use in the delivery and during the childbirth. Now you can watch a lot of videos on topics ranging from biochemistry to physiology, from anatomy to rheumatology, to courses in medicine, in gastroenterology, even radiology. You can find more than 1200 videos on sqadia.com. You can find lectures on almost any topic. You can even start your free trial for 2 days for free. You can even download the app on both your Android devices and the iOS devices. So again, thank you so much for watching sqadia.com.